If I'll be talking about my course, Allied Health Science in the Radiology department, the exposure that we are getting here, the faculty, the mentors, they are really experienced. Every day we are learning new things. Even in the first year itself, we are getting the opportunity to go to the hospital for the clinical postings, which is really great.
First and foremost thing I was inspired about DSU was about its global exposure to all the things and its collaborative things, and even the teaching staff, they are motivating us very much and are supporting us in everything, and well equipped reading rooms and libraries are one of the most greatest things of DSU.
So basically we have like different departments. So we have like radiology, surgical OPDs and general OPDs. So we are students like 10 batch, we are like separated into different postings. So where I am posted right now is on radiology. So here we just don't go there and sit there for like 1.5 hours. We go there, we just learn about what is CT scan, what is MRI, we just go sit with the doctors, we see what all is going on.
Having CDCIMER integrated with the medical hospital helps us very much, as we are allied health science students. It helps us very much in practical learning, and the aspects which they teach, we understand it very much better.
There are few workshops that I've attended, few guest lectures who are at a very remarkable position in their life, and they actually help you to face the reality of what you are going to be in the future, and who you are going to be and where you are going to stand.
From beginning only, we are getting to know how to handle patient, how to manage medicine. Even in the first year itself, they are teaching us about the medicines, also how to guide, how to talk to the patients and everything. So because of which it's a really great experience to be here.